friends, welcome to another episode of Sharing with Friends. Come on in, pull up a chair while we have this amazing conversation with our friend, Dr. Maggie Keane. As you know, Sharing with Friends features inspiring conversations with experts centered around uplifting and celebrating the Down syndrome community. So today's conversation is going to be very helpful, very educational, very insightful. And Maggie is actually a pediatrician who serves families in the East Valley through Acts of Kidness Pediatrics. She's a mom. She's also an incredible advocate in the Down syndrome community. So we're really excited to chat with you, Maggie, today. And also as a mom to a son with Down syndrome, we know that you bring some really valuable insight on how we can best support our kids, especially during the flu season. So we're excited to chat with you. Thanks for being with us.
Thanks for having me.
So Maggie, first off, tell us a little bit about your background as a physician and as a mom to a kiddo with Down syndrome.
So I went to undergrad and grad school, med school in Omaha, Nebraska at Creighton University. And then that's where I met my husband, and he went to undergrad and grad school there as well. And then we wanted to try something different. So with residency, we opened and just let wherever it fall be. And we got placed in Phoenix, and we fell in love with it. And then I did my residency at Phoenix Children's Hospital. And then we started having family. And so my oldest son is 18. So, and then my second son is 15. So we have a senior, freshman, and then my sweet son, Pete, with Down syndrome is going to be 13 in a week. And then our last son, Frankie, is 9, and he's in 3rd grade.
So a mom to all boys. You're a boy mom.
Yep. I love it.
Oh, that's so awesome. Yeah. And so tell us a little bit about, so how long have you been with Acts of Kidness?
So when I first came out here, I've always worked in the East Valley, and I've always lived in Central Phoenix. But when I first came out here, my first job was in the East Valley, but it was with a different company. And then we decided, a few of us, pediatrician moms, decided to break off and do our own clinic, and that's Acts of Kidness. And so we've been doing that now for 9 years.
I love the play on words too.
Yeah.
Acts of Kidness, because your eye naturally wants to say kindness, of course, and that's a play on words, but that's super cute.
Yeah, we like it.
Yeah. So let's talk a little bit about just the season and staying healthy, because that's just, you know, right now during this time of year, it's a conversation that's top of mind. How do I keep my kiddos healthy? How do I keep my family healthy overall? Right. But especially with, you know, kids with Down syndrome, is there anything in particular that we need to be talking about, tips and suggestions? So first off, why is flu season something families in the Down syndrome community should be mindful of?
So really any season or illness we should be mindful of, but this one, especially because of respiratory, they could just kind of plummet quicker. If you can prevent it, I feel strongly that we all should. I know there's a lot of vaccine hesitancy out there, and I understand and respect it, but at the same time, these guys need our help with prevention, and so I think the vaccine is really important. For several reasons. They have a little lower immune system at baseline, but then if you think like mechanically, just facial features, it doesn't drain as well, and so it can become harder and thicker and viscous and just a big snowball. So if you could prevent it, I just would strongly recommend getting the flu shot.
Okay, so that's a good tip. So the flu shot is definitely a preventative measure and suggestion.
And actually they have myths too, so if they're really like, because some of our kids, you know, are really sensory as well, and so shots sometimes are the easiest just to get it over with. But there's also a myth that they don't have to like time it, you just spray and then that's it, but they have to sit
still. So it's a mist in the nose.
Oh, it's just 1, 2, that's it.
And is that like something that they would say a family would want to go with a missed option? Is that something that is similar to the flu shot as far as timing goes? Is it just like
100%.
once a
It's just once a year.
Once a year. That's really good to know.
However, that goes out quick because everybody wants that. They don't want the shot. And so many offices only order a big bulk sum, and then they might get swept out early.
Okay.
So again, try to get your kids in around October to get that done.
But at least it's good for parents to know that there's even that option.
Yeah, for sure.
No? So
but then another thing I hear all the time is like, because right now it's January and they're like, oh no, we're kind of already over the flu, and that's not true at all. We're not, especially out in Arizona. And I don't know if it's because of the milder climate, but we see it well into April sometimes. Yeah. So I would still say go get it now.
So you touched a little bit you mentioned something about, kids with Down syndrome typically might have a little bit more respiratory issues or a lower immune system at baseline. So let's talk a little bit more about that. Are children with Down syndrome more vulnerable during flu season? And if so,
yes, just because of those main factors, really. Yeah.
Okay.
I mean, they are, especially if there's any underlying comorbidity that is going on, whether they have, because at baseline we might have either celiac or respiratory, like asthma type stuff, or thyroid. Thyroid goes through the whole body, so if we have those other things, then adding this on top could just make it even worse.
So let's touch a little bit about, because it's still in that same conversation, just immune function as a whole, like in general. So how does immune function typically differ between kids with Down syndrome, if at all?
So there's different things out there, but really they just say that there might be an underlying baseline of lower antibodies, like immunoglobulins, that kind of fight off these things. So at baseline, they're starting down here, where others might be at normal antibody and immunoglobulin levels. And so there's just that extra step. Then you add the mechanical things with like the not draining of the ears or the nose, and not having good muscle tone to get those coughs up, and then it can sit and be more of like a pneumonia. So it's kind of just a double-edged.
Okay. So then going into, and you already touched on the flu shot, of course, but going into maybe more preventative measures, what are some preventative steps or
hand washing for sure? For sure. I mean, that's kind of an obvious one, but it's such a big one, hand washing. And bigger spaces with lots of people, it's okay. I definitely don't want these kids to be walled off and things like that, but travel, and then like bigger places like airports or malls where it might be going around more, just kind of being cautious, not going, but just being cautious.
Not in a bubble. Like we don't want to be in a bubble, but at the same time, just being mindful of, like you said, like the hand washing and just the other things that families and parents can do to keep their kiddos healthy in general. Okay, so let's move on. Let's keep going. You're giving some great advice and tips, and we just love to, this is why we have Sharing with Friends, is because, like I mentioned earlier, we bring in experts who are amazing at what they do, and we want to share their voice with the community and with families and parents that are watching on the best things that, whatever that topic is about, how they can be proactive and how they can really just support and nurture and love on their families. So doing a great job. Thanks. So let's talk about then, and I was really interested, this question, let's talk about nutrients and supplements. I mean, that's
that's really hard because again, I can only really speak for my son, and he is a sticky little guy, and he also has dual diagnosis, so he has autism as well. So he's very rigid on what he will eat and what he won't. And so I have a lot of compassion for those families because I'm living it every day, and it's really hard to get good nutrition in those guys. So there's other things you could do like vitamins, but really it's just doing your best and not trying to think. There isn't a magic pill out there, there isn't. I mean, there's lots of things that are good, like a multivitamin or elderberry, but as far as preventing flu, Supplements really don't
Yeah.
do much for that.
Mhm.
It'd be more preventative actions.
Yeah, like long term. So let's talk. Let's go beyond flu season. Let's
Okay.
just talk about year round.
Okay.
You know, so aside from, of course, healthy eating and doing the best that you can, you know, to get more nutrients into your child's body, anything with, in particular, with vitamins or supplements that you have?
Honestly, no, not
Okay,
really.
okay.
I would say exercise and getting
Okay,
out
that's good.
is a big one, because a lot of times we like to just sit and watch stuff and not
Yeah.
get out and move our bodies. And I think that's really important because of just the body habitus. Some are little peanuts, but some are a little bit bigger as well.
Yeah.
And then not low tone, and then not wanting to move, and it kind of just again snowballs.
Yeah.
So if you could try to get them to get out, go on a walk, go on a
Yeah.
bike ride, things like that, just to move their bodies.
Yeah.
Mm-hmm.
I mean, even like, what would you say, like even a 5-10 minute walk?
Anything is better than nothing. Yeah. And there's a lot of great Special Olympics programs. Pete does swim. And yeah, sometimes it's even a fight for him to do that, but at least he's doing something.
Yeah.
We got him one of those big trikes, and it took him a few years to be comfortable to do it, but now he cruises around our neighborhood, and I just like that he's moving.
Just moving. Yeah, just keep your body moving along with the other types of things that you can do.
Yeah, and if they are real social, there's different things. There's basketball, there's bowling, you know. Yeah. But there's a lot of things out there.
Okay, so with that in mind, you know, with the topic of just staying healthy, staying fit, staying active, we're talking about flu season and your best tips and practices on keeping your kiddos as healthy as they can be during flu season. Are there any final tips or thoughts or advice or just words of reassurance or encouragement that you could pass on?
Just know you're doing your best. You know, I think so many of us think that there's a magic pill out there for their health and for everything, but there isn't. Just do your best, love on your kid, and just know you're meant to be with this little person, and to not put so much stress on yourself, because I think that's a lot of us. We want to make sure that we're doing. Stop it, Jenna.
Oh,
that's not fair. Stop. Oh. Jenna's crying, and I love her. But stop it, because I think we put so much pressure on ourselves to make sure our kid is super healthy and doing all the right things, and just loving on them is the most important. Yeah,
that'll always be the most important.
Yeah, for sure. Yep.
So Maggie, when it comes to our kiddos with Down syndrome, let's talk about how do we know when it's something to be concerned about when it comes to an illness versus, like, for example, how do we know when it's just, say, a minor cold versus something to be more concerned about? Are there markers to look for?
So sorry to interrupt, but I get this question all the time, whether it's a typical kid or not a typical kid. And it is hard. There is no true way to know. Honestly, especially in flu season, the sooner the better, just to get in, because with the fever, usually we say, oh, it's just viral, let it run its course, you know, except for when it comes to flu, because flu, we have treatment, we have Tamiflu. And if you get them on that within the first 24 to 48 hours of symptoms, it can really reduce the severity and the duration of their illness. So in that case, I'd say come in sooner than later if there's any fever. But other signs, like especially if they can't really tell you what's going on, I know that happens with Peter all the time. And so what are the main things they do? They eat, they sleep, they use the restroom. And if those things aren't happening, that's a way to be like, something's up. It's always better sooner than later.
So for families who might happen to live in the Valley or, you know, the East Valley, do you have just one office?
Yeah.
Okay. And then what is the age range that your office serves?
0 to 18.
Okay, perfect.
Yeah.
So we'll go ahead and, of course, link Maggie's information, Acts of Kidness, into the description of this episode in case you want to. So cute, the logo. I love it. In case you want to reach out to her, in case you're looking for a new pediatrician, or you're looking for an office and you're a family who live in the East Valley, Acts of Kidness, Dr. Maggie Keane.
Thank
Perfect.
you.
Anything else you want to say? Any final tips or any words? You gave beautiful words earlier, but anything else that you want to share on flu season and just staying healthy overall?
Staying healthy overall. Yeah, like trust your gut. I know we all worry. That's what moms do. We just worry about everything. But I think you also kind of know when your kid's not doing well, and yeah, go in. And so what if they say no? Your kid's fine. It's a virus. You'll have so much more reassurance that okay, at least I just checked.
Yeah. Totally. Awesome. Yeah. You've been so good to talk to. We've enjoyed this conversation.
Thank you.
Thank you so much for taking the time out of your day. We know that you are so busy as a pediatrician and as a doctor. So thank you so much for being here with us.
Thanks for having me.
Yeah. And friends, we thank you for tuning in to this episode of Sharing with Friends. We can't wait to chat more, bring in some more dynamic, amazing guests. Make sure to like and subscribe with this episode and with the channel in general. And we will see you on the next Sharing with Friends on behalf of Sharing Down Syndrome Arizona.
Thank you.